As the government asks pharmacies to do more to ease pressure on GPs, new analysis has shown those in England are actually closing at a rapid rate. We've lost nearly 1,000 since 2017.
A third of those were just in the past year, but the biggest decline is in deprived communities where the need is greatest. They've seen more than a tenth shut down in 6 years.
Well, joining us now is Thorrun Govind, who is a community pharmacist in Manchester. Thank you so much for joining us, Thorrun. Can you give us a bit of background as to why so many pharmacies have been lost in the past 6 years?
Well, there's been funding cuts year on year and almost 800 million over the past 5 years. Inflationary pressures are also biting. So the same pressures that are impacting the high street, just like GP surgeries, for example, pharmacies are operating under an NHS contract. And it's really, you'll have seen this when you go into a pharmacy. You'll have seen more queuing, perhaps. You might have seen fewer staff available. And it's really upsetting because if you think about what we've just heard there, most pharmacies are there are pharmacies in areas which are deprived. And when we have these closures, and there's about just under 11,000 pharmacies now in England, which has been a massive cut, really. We're just at this scenario now where people are not able to have that care that they deserve. So, you know, most people can walk 20 minutes and you don't need a car. You can just get there to your pharmacy. But we're in a cost of living crisis now, which is really biting.
Yeah, and it makes a mockery of the whole NHS plan, doesn't it? You and I have spoken before about this. The government is very keen that, given that we have so few GPs, 25% of GPs are going to retire in the next few years, certainly by 2030. The great mantra is pharmacy first. Go to the pharmacist. The pharmacist can give you great advice. Well, what happens if you can't see a pharmacist? Doesn't work.
No, I mean, and what's upsetting is professionally, we have so many fantastic skills. We are able, you can come in and you don't need an appointment to see us. You might wait a few minutes or so, but ultimately we're a really accessible healthcare professional. I mean, I've had it where someone's actually been having a fit down the road and someone ran to find me and they said, can you come? Because they knew they could trust me as a healthcare professional who was accessible to go and help. Now, people are also coming to us with their prescriptions, and we're also doing services like flu vaccines. We're helping people with their blood pressure. We're a really key part of the community, and the government doesn't seem to recognise this.
Yeah, and it's not just small independent pharmacies that have been affected, but big chains like Lloyd's and Boots. Boots lost 40 branches in the last year, announced a further 300 closures over the next 12 months. And I believe, I don't understand this as well as you will, David, but I believe that the more closures there are of big chain pharmacies, the more pressure there'll be on local community pharmacies. Is that right?
So we're all community pharmacies out there, whether you're in a big chain like that or a tiny one pharmacy on its own. But this has happened to me in practice. So one day, which we'll talk about in a little bit, but that meant that we were not geared to cater for the influx of people who came through our doors that day. It was really, really tough. So you might see lots of pharmacies close to each other and think, oh, it's fine, there's another one. But ultimately, due to the cuts that we've had, they're not geared to deal with more and more people. They're geared to deal with the community that they've been supporting already. And in terms of the staffing as well, we are seeing pharmacists who are deciding that they don't want to work in community pharmacy anymore. Some of them have portfolio careers and some of them are leaving pharmacy altogether. And our staff, our pharmacy teams, who we need to be able to safely get the medication and provide those services, it's a very stressful environment and they're at risk of burnout because there's probably easier places to work than in a hectic, busy community pharmacy.
I think you touched on a really important point here in terms of the numbers of pharmacists that are missing. Something like 16% of positions are unfilled, also 20% of technicians. And also the community pharmacy does more than just dispense medication, doesn't it? It's really important that a pharmacist, you're there, you can talk to them, you can get advice, as you said, but also you can do blood pressure checks, you can look at risk factors like cardiovascular disease, you can do blood pressure. And of course, we saw the role of the pharmacist in immunisations in the COVID jabs.
Yeah, flu vaccines gearing up. We're gearing up for that this year, providing the nation with flu vaccines. We did a record number last year. It seems ludicrous that the government can't just recognise that. We can't just carry on with the bare minimum. And we heard this announcement earlier this year, where we're going to be doing common ailments, so a sort of 7 conditions that you'll be able to see your community pharmacist for, and you won't need to go and see your GP for, or your prescriber. So the problem is, though, we're still waiting for all the detail of that. We're waiting for actually that to come into fruition. And it's really professionally frustrating sometimes as a healthcare professional, when sometimes you know what the patient needs, but because you're restricted by the bureaucracy, I have to send that patient back to their GP to then come back to me for a prescription. It just doesn't make sense.
Can I just ask, what is the answer, though? Is the community pharmacy the right way to go? We've talked about the rise of diagnostic and treatment centres, i.e. putting the GP, the pharmacy, scanning all together in one building. Is that a model we need to go down, or do you think actually community pharmacists should remain as they are?
Well, it is a model that has started where we were starting to see more pharmacies linked to GP practices, but ultimately some of those buildings are owned by the NHS, and some of the rates are very high for the rents in those buildings as well. So the rents are also stopping community pharmacies from perhaps moving to other areas. We don't get support with our premises. So, you know, that consultation room that we can take you in for privately, that's been a lot of the owner's own investment into the community pharmacy themselves. There's a lack of support for us to play this role, which we know we can play.
Yeah, absolutely. I couldn't agree more, actually. Thank you so much for your time.